Tomorrow. Yeah, my name is Fillemon Shikongo. So I'm a student nurse at the University of Namibia. I'm currently in my 4th year because we are doing 4 years studying nursing at the University of Namibia. So today I'm going to present on tuberculosis in Namibia during our primary health care. So this is one of the diagnoses that we usually diagnose in Namibia during our primary health care when we are caring for the patients at primary health care. This disease, it affects all the stage of age, like the elderly, children, the newborns, as well as the adults. They are likely to be affected by TB. So let's just explain a little bit. To check on the objectives.
Use this arrows here.
Okay. For the objectives, we are going to check about the definition. What does it mean by tuberculosis? The types of TB that we have in Namibia. We can also check on signs and symptoms, the causes of TB, how does it spread from one person to the next person, how it affects other people, the safety precaution measures, how to prevent TB from spreading, the diagnostic studies, how one can diagnose that this one is suffering from TB. How can you do that? We can also discuss about it. And the management, how the treatments and so forth. So without wasting time, I'm going to touch on the definition. What is TB? It's just an illness of the body, mainly caused by bacteria, known as the Mycobacterium, abbreviated as MTB. In Namibia, it's common in all age group, but mostly the elderly. As I have said that this one is just an illness that affects the body, mostly on the lungs. So the type of TB that is Namibia, so it usually affects the lungs. And these people are usually coughing every time, and then we are going to check on the signs and symptoms later. So why? Maybe because it affects elderly. So it's just simply because the elderly, as they are aging, their body functioning, they are also aging. So when they are becoming old, so the immune system depressed. So they are likely to be affected when the immune system goes below normal. So, okay. These are the rates. Maybe in Namibia, it was conducted in 2016. So TB rate in Namibia, so the newborns, they have a small portion, maybe just 5%. They are being affected because some are given birth by TB mothers, or maybe the father is a TB patient. So these babies are likely to be born with TB. So, and the children, they are also have that portion, maybe just 10%. And the adults, a little bit, a large portion, maybe 20% of them. And the large part is for the elderly. So the elderly are likely to suffer from TB in Namibia. Okay, what are the types of TB that we have in Namibia? We do have, number one, pulmonary TB. It occurs when the TB bacteria has entered the lungs. So this is the type of TB that mostly dominate the Namibians. They are likely to suffer from pulmonary TB. It's usually you just obtain the bacteria from the air, and then you inhale that air, and then it goes straight to the lungs, and then it multiplies into numbers, and then destroy your lungs. So this one is likely, and it's more common. Then the type number 2 We have extra pulmonary TB, EPTB. So it occurs when the bacteria travels within the leukocytes, the white blood cells, to other areas of the body. So this one does not live in the lungs, but mainly it can occur in the spinal cords here, the spinal cords, or maybe the brain. So these ones, they live outside the lungs. So they don't live in the lungs like the first one, but outside. So, but those patients that have extrapulmonary TB, they also have pulmonary TB. So they are two in one. So those are some of the two types of TB that we encounter in Namibia. Okay, this is just an example of a patient suffering from extrapulmonary TB of the spinal cord. So we are likely to have them, like in that case, we have them a lot in Namibia. So they are still admitted in wards and they are suffering like that. Sometimes you can find them like that, but they are visiting the hospital for the first time. I don't know, they don't know the signs and symptoms of what time maybe to go for healthy assistance. So they come at a late stage and then TB are to be rolled out at a late stage like that. So it's very, very, very dangerous. Okay, coming to the signs and symptoms, we have point number 1, cough for more than 3 weeks. If you are coughing, and then that cough doesn't get better for more than 3 weeks, that's already a sign of TB. So you should go for at least for a clinic or a primary health care nearby to be tested for TB. And then it's usually productive of sputum, and then those sputum may be blood stained. Okay, when you are coughing now, you have to produce mucus, that's sputum. So when you are producing mucus and then sometimes it's kind of bloody, red in color, you are likely to suffer from TB. So you need to go to the hospital nearby to be tested for TB because it's one of the signs of TB. Hemoptysis is just the vomiting of blood. Maybe you are just vomiting blood for a couple of days and you have chest pain, you are just paining on the chest every time you are waking up. The chest is pain, maybe due to coughing a lot of times. And you have also night sweats with fever at a temperature of 37.5 Celsius degree and above. So when you have fever of this, we usually test for TB to every patient that we are nursing in Namibia at the primary health care. When you have a temperature of 37.5, you have to test for TB as well as malaria. Malaria is one of the signs coming with fever. You can also have loss of appetite. So you are just not willing to eat anything. You'll be like, no, I'm just fine, but you are starving. So it's already a sign of TB also. The shortness of breath. I have observed, I have been working with Carol, but when people are having shortness of breath here, they are likely to have asthma. Okay. So, but in Namibia, asthma is not common. So we can rule out TB when they have shortness of breath. So it's likely to be a sign. But for you to be diagnosed with TB, so you can have 5 different symptoms, which is fever. You can also have some lymph nodes swollen here. You can also coughing for 3 weeks, as I said earlier, loss of appetite or weight loss, and the night sweats. So those 5, if you have them, all of them, you are already like to be affected. Symptomatically, you are a TB patient. Okay. The next objective is the cause. What are the causes of TB? So we have number one is inhalation of TB. When you are inhaling a TB from somewhere, maybe, let me say I have TB, and then I just cough everywhere, like everywhere. When you come and pass by, you are likely to obtain that bacteria that I have coughed out there from the air. So you swallow it, it goes through your esophagus, it goes to the lungs. So you are likely to be affected by TB. Alcohol consumption, this is the dangerous cause of TB in Namibia. So these patients who are consuming too much alcohol, they are drinking every time and everywhere. So they are likely also to be a contributing factor to TB. Smoking and drug abuse, malnutrition. Malnutrition is a main cause in children. So when children, they don't eat enough balanced diet, like enough nutrition, so their immune system will be low and they are likely to be also affected by TB. Air pollution also, unsafe sex. Yeah, maybe when you have unprotected sex, and TB is likely also to spread through that. Hypertension, mostly on our patients also, they are suffering from hypertension, especially the elderly. So most of them, they are on treatment. And our elderly age, it only starts from 60 and 70 there, but we don't reach 80 or 90, most of them. So they usually died at around 80 years if you are grown up. So yeah. Moving to the another objectives that I have is how it spreads. As I have already explained this one, so the airborne is just when you cough out of the air and then someone can occupy that bacteria, so you are likely to be affected also. Person-to-person contact, when maybe I cough, maybe I use my hand to cough, then I cover my mouth. When I hold like this, so when I cough something, the saliva comes here. Then it contains bacteria, somehow saliva from the lungs. So when I come and shake hands with you, you are likely to obtain this. And when you are going to eat maybe an apple without washing, so you can already consume that bacteria and you are likely also to be affected. Also contaminated items, as I explained, maybe I cough and then touch the handle there, then I touch with my bacteria on, someone come and touch and spread somewhere, so it can also spread in that way. Yeah, safety precautions, or how do we care for the patients now, how to prevent TB from spreading. So when we are coughing, those patients that are coming to our healthy primary care with TB, we usually teach them how to cough. This is the teaching now, how to cough. So you have to hold your elbow like this and you cough here. Then you leave it. Because no one will come and shake hands with you here. Yes. Because it's likely to come here. So you cough like this. Then it goes. And you also, when you do it like this, you prevent it from entering the air. Unlikely, then you leave it there. So it's protective. And we used to give also them face masks just to cover them their mouth. When they are coughing, that saliva, it's blocked by the mask, so it doesn't go into the air or anywhere else. Okay, and maybe for the hands, so yeah, we are teaching them how just to wash their hands every time they use the toilet or cough, so they need to wash their hands. Okay, I'm almost done. Don't feel tired. Okay, we have the diagnostic studies, how maybe a doctor rule out TB. Because in Namibia what we have is nurses, they don't really diagnose a patient. They only diagnose patient symptomatically. So according to the signs and symptoms. So when the problems is a bit big, so they send this patient to the doctor to see another diagnostic studies. So the doctors are likely to order X-ray for the suspect, like maybe someone is suspected with TB. They don't only go to the treatment that time when they have those signs and symptoms, but X-ray needs to be done just for confirmation. So they take X-ray for of the lungs and the spine. Maybe it's an EPTB. So another diagnostic study, we have sputum collection. So we give our patients, we give them like a bottle like of this size, just a specimen bottle, so that they used to go with them at home, and then they carve that sputum in, they cover it nicely, and then they bring it to the lab at the hospital. We have also how now to manage this. How do we treat TB patients in the primary health care? So we give them a combination of anti-TB medications. We have TB medications that we usually give, but they are being prescribed by the doctor for the patients to take. And it really takes time for them to, I think it's, if I'm not mistaken, 6 months on that treatment. We call it a first line therapy. So they are given isoniazid, rifampicin, pyrazinamide, ethambutol, and an injection of streptomycin. So these are all, the first 4, they are all oral pills, medications. So this one is an injection given on the muscles. So we also manage them by dot therapy. Dot therapy is just direct observed therapy. So we encourage them to come to the primary health care, and then we observe them how they are taking medication. Because some of them, they are likely to be defaulters. They don't drink medication. We give them medication, they go home, they keep it in the locker. They sleep as they feel like. So they are likely to do that. I think I'm done with my presentation, and that's a Mike here at Närhälsän. Thank you very much. Yeah. Or maybe any questions, maybe you can ask, even in Swedish. Okay, yeah, maybe any questions if you are.
Like who pays the X-ray? Is it the patient or?
Oh, okay. For the X-ray, it's for free for them.
All right.
It's free. It's part of their. They just pay $30 for registering their name. 30 Namibian dollar is just maybe 15 Swedish crowns only, and then you are free to everything. Medications you are given, X-ray you are being taken, or maybe even the admission sometimes. If you are going to be admitted for 4 days or 5 days in the hospital, it's also included in those 30 Namibian dollars. So it's just for free for them. Yeah.
How many percent don't use their treatment?
Or those that don't use their treatment. We have encountered them a lot, but I don't have the exact number, but maybe among 10, there might be 3 of them. Maybe 3 of them among the 10s. So that's maybe 15% of the Namibians, they might not drink the medication because they are so bad. They have some side effects. You can have diarrhea if you take them. You can have stomach ache. You can just feel dizzy even. They have strong side effects. So they are just not good at all. Okay.
Do you vaccinate everyone?
Oh yeah. Vaccinations we give them to, like for the newborns, we usually give them at birth. We give them BCG. It also prevents them from TB, acquiring TB. And the adults ones, we don't really have that. apart from polio that they used to give to children also.
You give it to the adults.
Not really to the adults, only to the children. Yeah.
But do you vaccinate every newborn?
Yeah, every newborn.
Even in the countryside?
Yes, the whole country is being just when the baby is born today, tomorrow is already BCG.
Okay.
Just to prevent them from being affected. Yeah. Maybe any question again? Okay. Thank you very much.
Thank you.
You got it.